Respected V. Padmaja ma'am for the next session, and may I call Dr. Sandhya Nair ma'am to introduce the session for her.
It's my privilege to introduce an distinguished obstetrician and gynecologist. She did her post-graduation from All India Institute of Medical Sciences, New Delhi. She is currently serving as the clinical director of Medsi Hospital and is the chairperson of the Rural Health Committee of the Indian Menopause Society. Dr. Padmaja has held several key leadership positions, including president of Vijayawada Menopausal Society from 23 to 25. She was vice president of Indian Medical Association 25-26, continuing to be. Founder chairperson of the Andhra Pradesh chapter of Indian Society for Assisted Reproduction 2017-2020. And president of Vijayawada Obs-Gynae Society from 19 to 20. Her contributions reflect strong leadership in academic, clinical, and organizational domains of obstetrics and gynecology. Today, she will throw light on the topic the hormone smile, how estrogen affects oral health. So we are all eager to listen to you, madam. You're welcome.
Thank you, madam, for that introduction. I was listening to Prashanti's talk, so mine will be a recap of all the salient points that she covered. Can I have this project? Okay. Fine. So basically, I'm talking about, as a gynecologist, how we think hormones, and predominantly the feminine hormone of estrogen, how it affects our smile and oral health. All of us start off as a single cell organism. There's half the genetic material from the woman and half from the male, and all the cells in our body start from there. So whatever is the genomic code that is there, whatever are the receptors that are there, they're there in all systems. So there are, only thing is how a hormone acts on a particular organ system depends upon how many receptors are there and what are the second messenger systems that are happening and how responsive it is to that and what are the other co-activating and inactivating factors. So take it for granted that estrogen receptors are there in every part of our body and oral cavity is no exception. So other than reproduction, other than in the uterus, other than having a menstrual cycle, other than having breasts, what does estrogen do in the oral cavity in women is that it is predominantly there in the salivary glands, because that is what causes the secretion of the saliva. The gingival tissues, unless they have a good amount of estrogen, it is a balance between the pro and the anti-inflammatory cytokines. So how much inflammation should be there, how much immunity should be there is what they take care of. All the surfaces of the body that are exposed to outside will need a very strong inflammatory process. Otherwise, we would be invaded by bacteria. But we need to also stop the inflammation before it destroys us. So that balance is what the gingival tissues have, and that balance is controlled and helped by estrogen. And collagen, the strength depends upon estrogen. All of you know prolapses occur after menopause, everything sags. So similarly, collagen all over the body has estrogenic influence. And as was very rightly pointed out, we are worried about osteoporosis. And remember that the mandible and the maxilla have a lot of areolar bone. So osteoporosis in the rest of the body will also have osteoporosis of the jaw. And estrogen is one of the best healing agents. That is the reason why the entire endometrial cavity is shed off, and by the end of menstruation you have the entire proliferative endometrium growing without leaving any scar in the beautiful thing. So cell proliferation and apoptosis, that control is with estrogen. So when estrogen is not there, all the responsive organs are affected. And so we have to look at our oral cavity also as a target organ of estrogen, and not assume that it is just the reproductive organs. Estrogen is more than a reproductive hormone. And As we, if you can see here, this is the salivary gland. Uh, Estrogen receptors are alpha, beta, truncated, so many. But what we need to remember is estrogen, beta is the one that grows, alpha is the one that stabilizes. Two simple things. So you can see in the salivary glands, it is predominantly estrogen beta. And in the periodontal tissue and in the mucosa, you have alpha and beta. So these are necessary for this collagen maintenance, cell proliferation, and the amount of keratinization. So atrophy, like in the vaginal mucosa, will also cause in the oral mucosa an atrophy. And when we have sufficient estrogen, there is a high flow rate of saliva, and the saliva pH is neutral, which helps remineralization of the teeth and the gingival region. So when there is estrogen deprivation, the flow rate is decreased, there is acidic pH, and this is what increases the amount of calcium deposition there and formation of plaques. And the clinical impact is, as I was already told, there is a decrease in the taste, there is an increase in the caries risk, there is difficulty in swallowing, and everything the mouth should do will not be happening. And this slide was already shown. And what I want to emphasize is that when there is estrogen deficiency, there is less apoptosis of the osteoclasts, and there is increased rankle differentiation, so there is increased bone resorption. So we are losing more, and the osteocytes also undergo apoptosis, so they're not converting into osteoblasts, and there is increased apoptosis of the osteoblasts also. So you don't have formation, it is a constant withdrawal and no input into our bank account, so we lose bones. And not only that, there will be a change in the oral microbiome. So there is a abnormal oral biofilm, and along with the cytokines that are there, there is going to be local inflammation, destruction, as long as there is constant acid, however strong the enamel is, it is going to pit. However strong the bone is, because it is still going to have holes in it, and this is going to cause alveolar resorption, and this is what is going to cause an increase in the infection and loosening of the teeth, and a loose tooth will be a lost tooth at some point of time or the other. And this estrogen deficiency also increases the interleukins and the tumor necrosis factor, which are the inflammatory cytokines. In a burning mouth syndrome, although there are multiple causes, female to male ratio is 7:1, so it is predominantly a female. It usually occurs much after menopause, not in the early menopause, and sometimes women are said it is psychosomatic. I mean, I think sometimes we become mother-in-laws then, and anything the daughter-in-law makes doesn't taste good. So that's what they say, you're psychosomatic, you're just finding fault, but there is a physiological reason for that. And on exploration, the small to medium diameter primary sensory neurons are there, which have this TRPV and P2X2 receptors. So these receptors are important in the perception of pain, and not only, pain is it's a protective phenomena. So we know that if you put a hand in the fire, it will burn. So with the pain, we take it out. If we did not have pain, we would still be holding it, and a hand, we would lose a finger. So pain is a protective phenomenon. Pain is not really bad. But abnormal perception and perception without the trigger, that is pathological pain. And that is what is happening when the nerve receptors are triggered. So estrogen is the stabilizing factor for that. How our temperature thermostat in the brain is stabilized by estrogen, so you don't have hot flushes and cold sweats all the time. Like that, this pain perception is stabilized by estrogen. And when there is lack of estrogen, there is hypersensitivity to heat and spice, and there is hyperexcitability of these neuropathic neurons, and the nerve growth factor also increases, so that also decreases the pain threshold. Regarding, people have gone back and seen how was the bone health and the periodontal stability in women who've had HRT and not had HRT. So one of the added benefits of using menopausal hormone therapy will be that better teeth health. But we are not going to be using it for that primary reason, but that's one of the thing. And already about salivary secretion is also been covered. And and I was talking about the dysbiosis that occurs. So lack of estrogen decreases the variety of microbiome in our oral cavity, and anaerobic periodontal pathogens increase, so that increases the incidence of plaques. And we need to, as we said, not every burning mouth is hormonal. We need to rule out nutritional deficiencies. At that, like inevitably nowadays, women of 35 are becoming diabetic. 40, they're invariably hypertensives. They're on multiple drugs. They're on multiple, every third person is a hypothyroid. So all these also long-term consequences, however well we control, they're going to be there. Oral candidiasis is very common with poorly controlled diabetes. There can be lichen planus, which is an autoimmune disorder, which is more common in women. And if there are dentures, that can also cause a mechanical irritation. So when we are talking to women, it takes hardly a minute to ask, does your mouth feel dry? Do you have bleeding gums? And do you have abnormal perception of burning pain? So it will not take more than a minute to ask that. So I think asking that is also very important, because they don't know that they have to tell, they don't know that there are solutions. So asking that will definitely help. So as Prashanti said, quality of life will improve when we can cross-reference and use the help of subspecialists who are now available in almost every part of our country. And so life does not have to be this way, and it can be a pretty, the mouth is a mirror of the hormonal reserve. So it's not just about the vertebral bone density, the kyphosis, the fractures that occur. It is also about our ability to eat, speak, and live without chronic pain. So just make it a point, if one take-home message that we can give, just ask your women when you're talking to them. Although it makes a lot of difference. Thank you.
Thank you, ma'am, for sharing your knowledge with us. We really appreciate your time and expertise. Thank you, ma'am.